Hello, I'm Mike Minarski from SNSN Radio. We're doing another video cast like we've been doing for the last month or so as we try to get as much information out to the public here in Eastern Connecticut about people that are making the news and the folks that are going to be making the news going forward. So as we know, this is an election year. For a lot of different positions. One of them is for the 45th district race in the state of Connecticut. The current incumbent is Brian Lanoue, the Republican, of course, who won 2 years ago, defeating Steve Michatel on the Democratic side. This year, Brian is the incumbent, and the competition is coming from the Democratic side. And there were and I got to be honest, I'd like to welcome Dr. Mark Deponte. Hi, Mark. How are you?
Fine, Mike. How are you?
Good. I got to be honest, I didn't even see you coming in the 45th district race. I had heard your opponent, Pam Patalano, had been, she was very heavily involved in social media and putting information out. I didn't even know that there was another candidate until after the convention. So give us an idea. How did this all happen?
That's a good question. It was something that kind of presented itself as an opportunity through ongoing conversations I've been having. I'm a member of the Griswold Town Committee. People have been talking to me for some time, and with the ongoing pandemic, things had gotten a little bit busy for me with my practice and other issues with that. So it wasn't something that I was actively pursuing, but when certain things came to my light as far as the present representation we have and the opportunity that there might be to get someone in there that might be a little bit more proactive when it comes to things, I was able to take that opportunity. The ironic thing about it, the funny thing about it, is that this process is more about delegate acquisition initially. I did get into this late, so I had to kind of focus on getting the delegates to know who I was, talking to them, which is also complicated because I couldn't go out and see them. I had to talk to them on the phone, people talking to me on the phone, just the voice they hear on the phone. But I mean, I was able to articulate, I think, something that was attractive to them and something that they felt was going to speak to their issues. I spoke to Sterling, Secretary Ballantown, all of the delegates, and the Griswold delegates. And at the end of the day, it sort of swung. Well, it was a 50-50 tie, and that was broken in my favor. But now the process is going to go to the larger community, and we'll get our message out in ways like this. So,
And yeah, communication has definitely changed in the last 3 months or so with COVID-19. I mean, I'm sure I don't need to remind you of that, especially what you do as a profession, being a doctor. Has your practice changed at all, or?
Yes, it has changed, and it's perhaps for the better in some ways, but we have been doing a lot of telehealth visits. So initially we had to shut down people coming into the practice so that we would be able to protect the staff. That was my primary concern initially, people coming in with the virus and getting everyone infected. So and a lot of people, I think, out of their own concerns kind of, were canceling appointments. So we were able to reach out to people using telehealth, getting the things that they need to them, refilling prescriptions, answering questions, hopefully, getting people tested, which we've got quite a bit of them done. So that has been a transformation, but we are starting to reopen. We have been open the entire time, and we are going to be bringing people back in a more regular way starting to Monday. So hopefully with a combination probably of some telehealth scattered in there. It is helpful for patients.
Have you found an uptick, like an amount of patients that you've been able to help and service via telehealth. I know New York University Hospital started this maybe about 2 months ago, and they went from seeing 70 emergency room patients to almost 700 with televisits. I mean, has that allowed you to see more people?
Yeah, well, I think so. There is still a little bit on my part. I prefer to see people in person, and there is that interaction, and that information that you can get just by looking at somebody is invaluable. But we have been able, I think, to keep up the practice's obligations to patients through telehealth and answering the phones. A lot of what we do. I mean, telehealth is a way to provide patients with a medical interaction that is billable to their insurance. Most of what we do hasn't, been billable, nor have we tried to. Traditionally, physicians have never been able to bill for telephone calls.
Mm-hmm.
So that's a difference. We still provide the services regardless. So, I mean, because that's really the way we run our practice. It's always been built around the idea that you do what's best for the patient and let everything else take care of itself. And so the volume has increased, I must say. We're here, we start the day at 9. The phones go on at 9. We're here usually before that, but the phones go on at 9, and we're here till 7 or 8 o'clock at night finishing up. So it has been more, the volume has increased, actually.
That's a very long day.
Yes, it is. But, it's what you signed up for, so,
So I guess my question is where do you find time to run for the 45th district?
That's a good question. Well, I mean, as you said, this media thing has provided us with another opportunity to get out to people. Social media has been invaluable for me. It's been basically my entire campaign to this point, for good and for ill. I think if I can get in front of people and start talking to them and listening to them, it will be helpful. And we're trying to start to move that along. But there are ways to get around the obvious limitations. I think we will probably see a lessening of the load, as you will. Part of the problem with my day being so long is not so much it's because the staffing has been limited because of concerns. So once we get people back in to do a lot of that stuff, we should be able to be a bit more nimble when it comes to timing and so forth.
So it's not really just going to be an election between you and Brian Lanoue. First, you're going to have to primary Pam Padalano. Yeah.
Well, it's not unexpected. I mean, the convention kind of was a tiebreaker convention, and I don't think that's a problem. I think it's always good for the people of the communities to hear what people have to say. And so the getting out and talking to people, or getting our information out, getting our platforms together and putting them out to people and letting them decide is probably the best way to do it. I mean, we are still a democracy, so I don't have a problem with that. I think it'll only make either one of us stronger in November, I think.
Mm-hmm. Okay. I'd like to get into some some medical questions, okay. Specific to COVID-19. All right. Maybe there's something that you could give a couple of pointers out to, like, for example, face masks. There's, you hear don't do it, you hear do it. Even Dr. Fauci, I've heard him give different views as the virus and information have progressed.
Yeah.
What's your take on face masks? Are they worth wearing?
So I think going back, my biggest concern, and I think the president may have had this calculation too, because if you do everything right in a pandemic, right, you prepare for it, you have the testing, you have everything right, nothing happens. Okay, right? So there is no pandemic because you did everything right. And I think in Eastern Connecticut, for a variety of reasons, I think the casinos closing early helped. We are naturally socially distant because we all have, houses that are separated. We don't have a lot of population density. We didn't see the big rush and big surge of cases that you saw on the western side of the state, closer to New York. And so I think with that, people kind of let their guard down a little bit. And I don't know why, but for some reason, wearing a mask has become sort of a political statement, or not wearing a mask. What we know about coronavirus is it does not have 100% morbidity. In other words, if you get it, you don't necessarily get sick, but you can spread it. And that's the problem. You're not sick. You don't think you're sick. So you go out and you go about your normal business, and you may be spreading virus to 10 people. And of those 10 people, 5 of them get sick and 2 of them wind up going to the hospital. So wearing a mask is not to protect yourself, it's to protect the people around you. And that's really the point of it. It's not, at the beginning of this, the information wasn't, we don't know. That's the problem with science, is you have to find out data, you have to get information, and then you come up with solutions to that, or hypotheses that give you solutions. And what we know now is that there's a very large cohort of individuals who will never become ill, but nevertheless can spread the disease to people who may get very ill and ultimately may pass away. We have coronavirus in this community. I have people who have been tested, and they've been tested positive. I have had at least 2 patients in the hospital with it. So, it's out there. And, the worst thing that could happen in this community now would be to lessen our vigilance, and we could see a spike in cases. I was at some Memorial Day ceremonies this last week, and there were people milling about without masks, and that was very concerning to me. And in states that have reopened, I guess in Wisconsin 2 weeks ago, the Supreme Court overturned the governor's orders, and they've had now the largest number of cases yesterday, or the day before yesterday. So about 2 weeks. It's a 2-week lag time. So we'll see, but I think it's vitally important that we continue to keep our vigilance with regards to the virus. It's still around. I just had a patient in the hospital last week with it, so we can't stop doing what we've been doing, because if we do, we could get into some serious trouble.
Right.
So wear your mask.
What's that?
Wear your mask.
Wear your mask. How do you think the opening of the casinos, like I know Mohegan Sun is kind of soft opening today?
I know.
What's your take on that?
I don't know. I have more than a few patients who work there. Some of them are very, anxious to get back to work, but some of them are very anxious about what that will entail. I have not seen what they're going to do and how they're going to protect both their staff and their customers. But we'll see. I mean, it's a concern. I also understand that these things have to happen. I mean, you can't keep the economy frozen indefinitely. But I think, we have to come into the casinos reopening, have to reopen with a mentality that it's still 2 months ago, not where this is still an ongoing process, not that we're out of the woods now and we're going to go back to normal. It's still too early for that. So, we'll have to keep our fingers crossed and see how it goes. I think if they're prudent, and they have been so far, it should be okay.
Are we out of the woods?
No, we're not out of the woods. No. I think until we get a vaccine.
Some people think we are. Some people think we are.
I know. Well, again, if you do everything right and nothing happens, people think that nothing would have happened if you didn't do everything right. So, you get this idea that this is all a big deal about nothing because nothing happened.
Right.
I think that's human nature, unfortunately. And I think if leadership has to be out front of the curve, and understand that this is going to happen, that if we do everything right, nothing will happen, then people will think we're the problem. We were the problem. The cure is worse than the disease. So I think people need to be out front on this and say that, no, the cure was not worse than the disease. And if we hadn't done everything we had done, we would have had a meltdown, like New York. In medicine, we always prepare for the worst, but hope for the best. So you have to take care of every contingency you can possibly think of. Even if you think that they may be a low probability, you still have to consider them and try to prepare for them. And that's always a balancing act. You know, the risks versus the benefits is what we go through with everything. Even in every medication you prescribe for a patient, you have to balance the risks versus the benefits. And those risks and benefits, that equation changes as the patient gets older. So that's another factor you have to, 90-year-old person doesn't need to take this cholesterol medicine, maybe, does it? It's an ongoing conversation. And that's the way I've been practicing medicine for almost 20 years. It's, I can't tell you to do anything. I can tell you why I think you should do something, but, every person has the right to say no. So, I have to be able to convey to you why I think this is the right course of action and why I think it will ultimately be to your benefit to continue in that course of action.
Sounds like things. Oh, go ahead. I'm sorry.
No, I'm just that's the way I do it. It's the way we've done it in this practice for, like I said, 20 years, me and Bert and Melanie. So.
It sounds like things change every single day, and the only thing you can do is learn from what happened yesterday. Is that basically the way medicine is?
Well, when I was in medical school, the old saw is, the guy stands up at the first day of the lecture series and says, half of what we're going to tell you isn't true. We just don't know what half is. It's an ongoing process. It's really just a process. The
right.
process is, there was a move back during the ACA when the Obamacare standard practices, best practices, and you have to hold to best practices. But best practices 5 years ago are different than 5 to this year. Look at aspirin, right? Aspirin, everyone needs to take aspirin. If you don't take aspirin, if you don't prescribe aspirin to your patients, you're a malpractice. And now, don't give them aspirin. You can't give them aspirin. It's the worst thing you can do for them. So, it's a constantly shifting under your feet. The ground is always shifting under your feet, and keeping an eye on again, when you think that you're going to do what's best for the patient in every case, I think the answers become a little bit more obvious to you. And that has been the guiding principle we've tried to hold for the entirety of this practice. Because, right, if you chase everything, you're never going to catch. If you follow every little trend that comes down the pike, you're going to be chasing your tail. And some practices do that. I've gotten patients from other physicians, and they're on every latest, greatest medication that's out there, costing them, if not thousands, hundreds of dollars a month in prescriptions, when, the tried and true standard generics are just as good and, often for some people free. So, you try to balance. Again, so it's a balancing act. Risk, benefits, cost is another risk. Is this going to cost this person a lot of money? And is it worth it? So you can't always chase after the shiny objects. You just have to hold to the core principles of what you try to do for people and how you try to help them.
Let's move on to something else. There's an organization called Power of Three.
Yes.
I believe
it's Power of Together. It's Power of Together 3.
Okay.
And I always try to push this. My wife was watching TV one night and saw a woman who's out of Niantic who has Power Together 1. So it's just called Power Together. But it's a club, really. It's hard to explain to people because when you first bring it to their attention, they kind of look at you a little funny. It's a club, and if you join the club, you commit to going to 4 meetings a year, about half an hour, and writing a check at the end of that meeting for $100 to some worthy cause. And we've been doing it now for about 2.5 years in Eastern Connecticut. And it's a dedicated group club that will find funding opportunities in Eastern Connecticut, either local charities, individuals. We did the Jewett City Little League, got our first, I think, donation. We've donated to a young boy who needed to work on his house because he's a little boy with health challenges, and they needed to refinish their garage, and so they didn't have the money for it.
The Osgood boy, right?
Osgood boy, right. So you go to the meeting, you sit down, you write your name. If you have a charity or funding opportunity you'd like to bring to the group, you put it in a hat, or we have a basket. The basket's passed around. 3 names are pulled out of the basket. You have 5 minutes to make your presentation to the group, and then everyone votes. and whoever wins the votes gets the money. And we have about 40 members at this point, and we have donated $44,000 to people and groups in this community. We'd like to get to 100. So spread the word, Mike. 100 people, each giving $100 is $10,000 a meeting, and that's really the goal. You know, it's another way that we have been trying to, you know, help the community as we see where needs may be. In the same way that I'm on the Eastern Connecticut Eastern Connecticut Performing Arts Association, Ray Churchill's group. I'm on the board, you know, and that's another group that is dedicated to trying to invigorate or reinvigorate the Jewett City downtown area by putting together a performing arts theater group with, you know, with all the ancillary development that may come from that, you know.
Yeah, I really respect Ray. I think he has nothing but good intentions.
Yeah, no, I think so. I mean, I think that, you know, there's something about Griswold, Eastern Connecticut, Voluntown, the area we live in. People who get it really appreciate where we are, you know. And I think what's coming because of the coronavirus crisis has been, I think, a renewed appreciation of where we are and how the opportunities that are here. I've talked to more than one person who's, and maybe you know, you got your finger on the pulse. Real estate is going like crazy around here right now. And people are selling their houses, you know, above asking price, because people from outside of the community are coming in and want to live here, especially because you don't have to you can live here and work in New York now. You don't have to live in Boston. You don't have to live in, you know, in these areas which are congested. So I think we may be, ironically enough, looking at perhaps a renaissance in Eastern Connecticut, because, you know, the people coming in appreciate what we have. Lots of rural area with great opportunities for recreation, hunting, the Patchogue. You're 2 hours from New York if you want to go to New York. You're 2 hours from Boston if you want to go to Boston. Yeah. You're 40 minutes from the beaches of Rhode Island. You know, even if you want to drive up to the Cape, it's only a couple hours away. And if you want to go skiing, you're 2 hours from Vermont. You know, so people think we're out in the middle of nowhere, but we're right in the middle of everything.
Yeah, I mean, I've lived here my entire life, and as I got older and started to identify some of these items, I never could understand why this area didn't have much more of a boom when it came to economic development. I mean, everything is right here. I mean, you have the highways. I mean, there is land off of the highways that can be built off of, which would be very easy for a distribution center, trucking company, you know, larger businesses like that. And like you know, to your point, we're right in the middle between New York, Boston, Providence, Worcester.
Right.
You know, right.
Yeah, no, I think it's a tremendous place, and a tremendous place to live. I mean, you have all of those opportunities. Plus, you've got the largest casino on the planet, right? You know, two of them, right? You know, 10 minutes away. With all of the, you know, my wife and I go to the casino Mohegan because we like to go to the pizza place, but we've never gambled there.
Have you been to the pizza place? Have you been to the same one though in New Haven?
Of course.
It's a little different.
New Haven. It's a little different, but it's close enough. I mean, you know. Yeah. I used to live around the block from that place, actually. So
oh, okay, all right.
I used to get takeout. I used to love going in there, walking up to the front of the line, and going all the way in and taking my pizza and going home. But yeah,
over to Sally's and get it, right?
Sally's, and then the Modern. You been to Modern?
Oh yeah.
Yeah.
Since we're talking about pizza, what's the difference between pizza and a pizza?
A pizza is what in Italian it's la pizza. They just dropped the L, so it's a pizza. It's the Italian slang word for it.
Because you go out to Meriden and North Haven, East Haven, New Haven. You see a lot of a pizza.
Well, everyone, you know, my father's father was born in Minori, which is a town in the Amalfi Coast. And if you go down to the pizza place in the casino, there's a picture on the wall. I think it's the same town. Everyone from Italy moved to where their friends moved in the United States. So I think a lot of the Italians in central Connecticut, down in New Haven area, came from that same place. And so they all carried with them the same slang terms, language. you know, and I think that's the of eats. It's always of eats, you know. So,
Mark, thank you for joining us. I appreciate
my
your
pleasure,
time.
Mike. Hope I didn't ramble on too much.
No. I told you it'd be about 30 minutes or so, you know, and
Yeah.
I wish you luck, continued success in your
Thank
practice.
you.
Thanks for the advice and you know, about COVID-19, and we look forward to seeing how the race shapes up in the 45th district between you and the other candidates.
I do too. I think anytime you have this kind of competition where people are actually, you're forced to talk to the issues, it's only going to be good for the people in the district, because they have to make a decision and they need the information. So
Exactly.
it's yeah. All right.
So can we do this again later on down the road?
Oh, absolutely. You know, hopefully we can get it a little bit more straight. You know, we had a little trouble getting connected, but you know, once we get that straight up, we'll be fine.
We're all set. All right. Thank you very much.
All right, Mike. Thank you. Have a good weekend.
You too.
I
Have a good
hope.
day.
Take care.